next month possibly. It is great to have Dr. Harish taking up the CPR session today. I'll give a little bit of introduction to Dr. Harish. He is a chest physician and intensivist at global hospitals. He has done his MBBS and DNB in respiratory medicine and some other medical qualifications. He has an experience of almost 23 years, which includes 12 years of clinical experience in critical care and 16 years in pulmonary medicine. His expertise lies in critical care pertaining to respiratory medicine with special emphasis on ventilators and non-invasive ventilators. After completing his MBBS, Dr. Chafle got a DNB in respiratory medicine from National Board of Examination, Delhi. He is also part of the several prestigious institutions such as the Indian Society of Critical Care Medicine and Indo-Australian Critical Care Foundation. He has published many articles, and it is great that Dr. Harish has consented to take up this session for the benefit of all of us, and especially all the Ashok Tower residents. So I'll hand over the session to Dr. Harish. He will conduct his presentation and his demonstration of how to conduct CPR for next 45 minutes or so. And then we will have a 10-15 minute session on various questions, queries, and discussion points. Yeah, Dr. Harish.
Yeah. Thank you, Mr. Anil, for those kind words of presentation and introduction of myself. I welcome all the viewers from Ashoka Gardens, Ashoka Towers, sorry, yeah, Ashoka Towers, who have logged in for this session. And I think this is a very, very basic training. And actually, we in India, they lack some training, basic training like this. And as I come along with the next slide, everyone would identify this human being, or not a human being, basically, it's a Superman, basically. And all of us wants to become a Superman. And if you follow the steps that I'm going to tell in next few slides and my presentation, if you follow, and we will do a hands-on presentation for you also, then I think every one of you can become a Superman if you follow all these things. So sudden cardiac arrest, that is what is the topic of discussion for today. मतलब दिल का एकदम से बंद हो जाना. दिल एक ऐसा चीज है अपने शरीर के सारे अवयवों में जो एक मेन चीज है, ये पंप कहा जाता है. अगर पंप फेल हो जाए तो बाकी ऑर्गन्स अगर फंक्शनिंग भी रहेंगे तो भी उसका कोई मतलब नहीं है. पंपिंग में क्या होता है, खून जो हमारे दिल में मतलब अपने बॉडी में होता है उसको प्यूरिफाई किया जाता है लंग्स में, और हार्ट उसको पंप करता है सारे ऑर्गन्स को सप्लाई करने के लिए. तो अगर आपका पंप फेल हो जाए, जैसे अगर पंप फेल हो जाए तो ऊपर टंकी में पानी नहीं जाएगा, तो सोसाइटी में किसी को पानी नहीं मिलेगा, तो सब हड़ताल हो जाएगी, आपका काम काज बंद हो जाएगा, आप घर के काम, पानी पीना, ये सब कुछ बंद हो जाएगा. So that's why this pump is very important, and this sudden cardiac arrest means that pump has failed. So the pump is inability to contract, and the blood supply to the whole system, brain, lungs, kidneys, you name the organ, and everything goes for a suffering, and that is how the patients become suddenly unconscious. Brain is one organ in the body basically who cannot function without oxygen and without glucose. Two very, very important things. And glucose and oxygen is provided to the brain by the blood supply that it goes to the brain. If the blood supply to the brain because of any reason stops, like I am explaining in the sudden cardiac arrest situation, what happens? The brain will function for a while, but after that it will not be able to function. So the patient goes into coma, they feel dizzy, chakkar aa jati hai, घूमने समय लगता है, and then they fall down. So ये situation है sudden cardiac arrest का, और ये कोई भी time पे आ सकती है. So is CPR really effective? CPR is, I'll just tell you, CPR is cardiopulmonary resuscitation. मतलब किसी का हार्ट पंप करके उसको रीस्टार्ट करना. It is like restarting a machine who has failed. So CPR plus defibrillation, मतलब CPR के साथ में एक मशीन आती है जिससे शॉक देते हैं. ये दोनों चीजें अगर within 3 to 5 minutes of collapse अगर कराएंगे, तो अगर 100 लोगों का डेथ होने वाला है, उसमें से 49 to 75% लोगों को हम लोग बचा सकते हैं. और इसके लिए कोई मेडिकल नॉलेज का जरूरत नहीं है. यू डोंट रिक्वायर अ हाई-फाई मेडिकल नॉलेज. इट जस्ट द बेसिक स्किल्स टू रीस्टार्ट दैट पंप व्हिच हैज फेल्ड. and this is given without doubt that 3 to 5 minutes, within 3 to 5 minutes. So as soon as you start, what happens actually, this cardiac heart failure or sudden collapse happens in situation where the doctor is not available. If it happens in the hospital, nothing like it. No one should have the cardiac arrest basically first thing to go about it. लेकिन अगर होता है तो ये मैक्सिमम टाइम हॉस्पिटल के बाहर ही होता है, जहां पे हेल्थ केयर प्रोफेशनल, डॉक्टर्स या कोई भी अवेलेबल नहीं रहता है. इसीलिए आम आदमी को ये मालूम होना चाहिए कि इनिशियल 3 to 5 मिनट, मतलब मैं ऐसा नहीं कह रहा हूँ कि पेशेंट को आपको ही ठीक करना है. इनिशियल 3 to 5 मिनट्स में अगर आप चालू करेंगे एंड देन यू कॉल फॉर हेल्प, द मेडिकल टीम कम्स एंड देन टेक्स ओवर द पेशेंट एंड टेक्स द पेशेंट टू द हॉस्पिटल, देन द सर्वाइवल रेट इंक्रीजेस फ्रॉम 49 to 75% लोगों की जान इसमें बचा सकते हैं. फॉर एवरी मिनट विदाउट सीपीआर, मतलब अगर किसी ने सीपीआर कार्डियक पंपिंग नहीं दिया, फॉर एवरी मिनट विदाउट सीपीआर, सर्वाइवल फ्रॉम विटनेस cardiac arrest decreases to 7 to 10%. Every minute 10% survival rate will go down and the patient will go to death. So that's why this is very important to learn. So that is why next slide is learn CPR, save a life and be a hero that we saw on the first slide, a Superman. So हम लोग इसको chain of survival बोलते हैं. मतलब if you do 2-3 things together properly and the whole effect works in favor for the survival of the patient, it is called chain of survival. एक एक कड़ी इंपॉर्टेंट है इस चेन की. सो पहली कड़ी क्या है? अर्ली एक्सेस, मतलब यू हैव टू गेट इन टच विद समबडी. सेकंड कड़ी क्या है? अर्ली सीपीआर. जितने जल्दी कार्डियक पंपिंग, हार्ट पंपिंग चालू करेंगे, हार्ट को रिस्टार्ट करने का कोशिश करेंगे, उतने जल्दी फायदा होगा. तीसरी कड़ी है इसकी अर्ली डिफिब्रिलेशन. अब ये डिफिब्रिलेशन क्या है मैं बताऊंगा आपको एज आई गो अलोंग इन माय प्रेजेंटेशन. एंड फोर्थ इज अर्ली एडवांस केयर. मतलब ये सबसे तो हम लोग सर्वाइवल इंप्रूव कर सकते हैं, बट इसके बाद की कड़ी अगर अर्ली एडवांस केयर, मतलब हॉस्पिटल में ना जाए जहां पे बाकी फैसिलिटीज अवेलेबल है और त्वरित उसका उपचार नहीं चालू करेंगे, तो ये 3 कड़ी भी कोई काम की नहीं. सो सारी कड़ियां इक्वली इंपॉर्टेंट है. इसके लिए जो वो सीन में मौजूद है जहां पे ये अरेस्ट हुआ है, उसने अगर इमीडिएटली चालू करेगा सीपीआर और ऑलरेडी इंफॉर्मेशन जाएगी हॉस्पिटल, तब तक हॉस्पिटल का टीम आएगा, तब तक आप लोग को मोर्चा संभालना है जो मैं बता रहा हूं उसके हिसाब से. सो दिस इज द सीन ऑफ सेफ्टी दैट आई वाज टॉकिंग अबाउट. इट कैन हैपन एनीवेयर. इट कैन हैपन नियर अ पूल, इट कैन हैपन इन द मार्केट, इट कैन हैपन इन द सिनेमा हॉल, इट कैन हैपन इन अ कॉलेज, it can happen anywhere, on the airport, anywhere where there is a lot of people coming, there's a lot of people coming and going around, and one of them can have this cardiac arrest. So this is the scene of safety basically. So that's why everybody needs to be ready with this so that you can help others. So सबसे पहली चीज क्या करना है इसमें? अगर आपके सामने कोई अगर एकदम से मूर्छित हो जाए या गिर जाए या सडन कोलैप्स हो जाए, सो पहली चीज है देखे, शेक एंड शाउट. उसके कंधों को ठोक के हमको देखना है, आर यू ऑल राइट. हमारा एक ब्रदर आएगा जो सारे चीजें आपको एट द एंड ऑफ द टॉक ही विल परफॉर्म इन फ्रंट ऑफ यू, सो दैट यू विल हैव अ लाइव डेमोन्स्ट्रेशन आल्सो ऑफ व्हाट वी आर गोइंग टू डू. सो शेक एंड शाउट मतलब उसके शोल्डर को टैप करके, हेलो आर यू ओके, आप ठीक है, आर यू ओके. ये सबसे पहला रिस्पॉन्स है, फर्स्ट रिस्पॉन्स. अगर ऐसा ठोक के ये करके, if it is just a transient event that is happening to the patient and the patient wakes up, he looks at you, he responds, you are not supposed to move forward. So ये पहला स्टेप करने के बाद अगर पेशेंट रिस्पॉन्स नहीं देता है, there is no reply from the other side, he does not talk, he does not open eyes, आंखें नहीं खोलता है, रिस्पॉन्स नहीं करता है, then you go to the next step. And the next step is basically call for help. It is not about just starting the CPR immediately, because before starting the CPR, you should call for help. And in that call for help, you should have number or of a doctor or a hospital nearby where all these things can be taken care of. So this call for help is important because you are not going to do it alone. आप अकेले नहीं कर पाएंगे, और आपने चालू भी किया तो उसको हैंड ओवर करने के लिए कोई तो मेडिकल टीम या मेडिकल डॉक्टर उसको आगे लेके जाने के लिए चाहिए. That's why this call for help is very important. अभी कॉल फॉर हेल्प के टाइम पे क्या चीजें इंपॉर्टेंट है, व्हाट आर द इंपॉर्टेंट थिंग दैट यू शुड टॉक whenever you are calling. First thing is don't get panic, because you are the one who is the leader there. आप वहां पे लीडर हो जो ये सिचुएशन को हैंडल करने वाले हो, तो आपको पैनिक नहीं होना है। सबसे पहला कंफर्म हु इज ऑन द अदर साइड। आपने कॉल लगाया और गलती से अगर दूसरा कॉल लग गया और आप सब बात कर गए लेकिन जो सुनने वाला है वो आदमी बराबर नहीं है, देन इट इज फ्यूटाइल। सो फर्स्ट कंफर्म टू whom you want to speak, whether the same person is there online not. फिर आपको बताना है कि एग्जैक्टली क्या हुआ है, कितने विक्टिम्स है। मतलब ऐसा हो सकता है कि 2-3 लोग एकदम से, कि अगर कोई बिल्डिंग कोलैप्स हो जाए या कोई नेचुरल डिजास्टर हो जाए तो कितने लोग हैं, ताकि जो आने वाला है he should know how many patients he is supposed to deal with and he will come prepared with that. एग्जैक्ट लोकेशन इज एब्सोल्युटली इंपॉर्टेंट। अभी के इसमें मॉडर्न युग में एग्जैक्ट लोकेशन देना कोई प्रॉब्लम नहीं। यू कैन शेयर द लोकेशन एंड देन द पर्सन नोज वेयर आर यू, व्हाट आर द स्पेशल रिक्वायरमेंट्स एंड हाउ मच टाइम टू रीच। आपको पहुंचने में कितना टाइम लगेगा, ये सारी चीजें ये कॉल में मेंशन होना चाहिए। दीज आर द बेसिक थिंग्स दैट आई एम मेंशनिंग सो दैट द कॉल शुड बी फ्रूटफुल। कॉल फॉर हेल्प जो हम लोग कर रहे हैं जिस चीज के लिए, उसका पर्पस सॉल्व होना चाहिए। इसी के लिए आई एम जस्ट एनुमरेटिंग द थिंग्स फॉर यू. The person making a call has to know all these things that he has to mention. Then comes CAB, cab, very common and very important thing whenever you are going around in Mumbai. You call somebody and the cab comes and your work is done. You reach to a place where you want to go. But cab here is not cab, but C in cab is for circulation. Circulation means the blood flowing in the body. So your first purpose was to see the responsiveness. Second purpose of this is to call someone for help. Third is now we are coming to circulation. So what is the objective of this circulation? Is to assess and management of circulation. मतलब circulation है कि नहीं ये देखना है, और circulation अगर नहीं है तो क्या करना है। अभी circulation है कि नहीं कैसे चेक करेंगे। So सर्कुलेशन है कि नहीं चेक करने के लिए पल्स, मतलब जो नाड़ी जिसको कहते हैं, जो जनरली डॉक्टर्स हम लोग यहाँ पे रिस्ट में चेक करते हैं, सबके यहाँ पे हम लोग चेक करते हैं। सो ये चेक करना एक बराबर करेंगे तो ये मालूम पड़ता है, या फिर अगर कोई कोलैप्स हो जाए तो ये नाड़ी भी फील नहीं होती है। इसके लिए हमारे गले में अपना जो विंड पाइप है, सो सब लोग अब एज यू आर वॉचिंग मी, यू जस्ट रन योर फिंगर ओवर द सेंट्रल पार्ट ऑफ योर नेक, central part of the neck. There is a tight pipe in the central part of the neck that is called as trachea or the main wind pipe. So if you roll your fingers and you go by the side, there will be a gap, there will be a depression. Okay, और ये डिप्रेशन में अगर आप अपने 3 फिंगर्स पोक करेंगे तो आपको एक पल्स महसूस होगी, मतलब कुछ जा रहा है आ रहा है, आ रहा है जा रहा है, ऐसा. So it is regular feeling basically. So you have to roll your fingers, go to the side and see the pulse. This is C for circulation. If there is pulse, as you can see in the diagram, as you can see, he is rolling and is coming down on the side, and there is a carotid. This is called as carotid artery. This is a artery that is coming directly from the heart out, and this is carrying the blood to all over the body. And there are certain branches to the upper part, lower part, and other areas. So this carotid will tell you whether circulation is present or not. And if the circulation is present, you are not supposed to do anything further, but just call for help. A person will come and then you can hand over the patient to them. But if this circulation is not present, you are not able to feel something. कुछ भी फील अगर नहीं हो रहा है मतलब पल्स नहीं है, और पल्स नहीं है मतलब सर्कुलेशन नहीं है. दैट मींस यू नीड टू गो टू द नेक्स्ट स्टेप. बट ये चेक करने में ज्यादा टाइम नहीं गवाना है. You are not supposed to waste 1 minute, 2 minutes. You keep on checking and there is no pulse. You have to spend at least not more than 10 to 15 seconds in this procedure. Because the moment there is no circulation and you are just sitting idle without CPR, the patient is going to die. There is no question about it. So come down, side and feel the pulse. Everybody will be able to feel the pulse. We'll show it on the mannequin also. Okay. I go to the next slide. So no pulse means there is no circulation, and that is when we are supposed to start with the chest compressions, that is called as cardiopulmonary resuscitation. What happens, our chest में जो ribs है, जो पीछे से आके आगे है, तो इसका एक cage बना हुआ है. Cage is like a cage, and our heart is in the center of the cage. If you press this cage is basically elastic and recoilable. You press, it will come back. It will press, you will come back. So our purpose is basically to press this rib cage so that the heart inside gets also pressed. So the manual function of the heart, which was pumping, which is lost because of some reason, if you press and come back, it is said that it will restart the functioning of the heart. So you can restart this pump just by means of compressions. But the compression has to be at a proper place. The compression rate means how much per minute. It has to be, it is, so all these were सबके टेस्ट हुई है, सबके स्टडीज हुई है और उसके अंत में सबने माना है कि ये सब कुछ ऐसा होना चाहिए तो ही इसका फायदा है, अदरवाइज इट इज नॉट गोइंग टू हेल्पफुल. So this ratio is 30:2, means what is this 30 and what is this 2? 30 is basically compressions of the chest. So you are supposed to press the chest for 30 times and then you are supposed to give 2 breaths to the victim, which is called as rescue breath. I'll tell you how the rescue breath is to be given. And the rate of compression should be 100 to 120 per minute. It is quite a bit, I'll tell you. I myself have experience and given CPR to so many thousands and lakhs of patients now in my career. You give one CPR in a proper cycle for 5 minutes, it is equivalent to 30 minutes of your rigorous gym exercise. It is that tiring, it is that training. Because the compressions and how much to compress, where to compress, I'll tell you. So, but you should remember this 30:2, 30 compressions and then 2 breaths. And rate basically of the compression should be 100 to 120 per minute. So we come, what is the proper place for placement of your CPR? So this is the chest shown in the form of the cage basically, okay? And this is what is called as the collarbone. We all have the collarbone. You can feel the collarbone where your collar lies. And below this airway, there is a depression and then there is a hard bone. Okay. So this hard bone is there till some level and then it ends. So this is called a sternum. The central chest bone is called sternum. And as you can see in the diagram, just below this sternum is your heart. This is the heart. And our purpose is to press here so that the heart gets compressed and it restarts. So if you go from here, there is a depression, then there is a hard surface, and then again there is a depression. So this is the sternum, okay, and at the end is called as xiphoid process, where after that there is nothing here. You are supposed to put your hands in the middle point of this sternum, mid sternum it is called. So chest compression should be performed on the lower half of the sternum. So if you divide this sternum into upper half and lower half, you are supposed to keep it at the lower half of the sternum, so that this is the area that can be compressed and that you will be able to restart the heart. So you can see the hands kept here at the lower half of the sternum, and once you press and upstroke and downstroke, what happens? The heart gets compressed and then it gets released, compressed and then it gets released. So this is the area we will show you on the mannequin as well. This is the area where you are supposed to put your hands. So C is for circulation, then A is for airway. In the cab mnemonic that I told you, A is for airway. And what is the airway? Basically, the objective of this is to identify the patency. What happens if somebody goes unconscious? किसी को अगर मूर्छा आ जाती है और सो जाता है तो जो मुंह में सिक्रीशंस है वो ब्लॉक करके एयरवे को ब्लॉक कर सकते हैं. सो अपना ये ए का ऑब्जेक्टिव है टू सी द पेटेंसी, मतलब एयरवे पेटेंट है या नहीं. सेकंड is to protect the cervical spine. There is a spine at the back. So if somebody has fallen and has got a cervical spine injury, then the second objective is to protect this spine. I'll tell you how to do that. And take measures to establish the patent airway. If the airway is not patent, like somebody had pan in the mouth and he went into unconscious state, then that pan can block the airway and whole thing can go for a toss. So you are supposed to see whether it is blocked or not. And second is to clear if there is something inside. So this is what I was talking about, an airway. This is your nose basically. This is the oral cavity and this is the chin. So through the oral cavity and nose, it goes to throat. this is your tongue, okay, and this is your airway, and this is your food pipe. They are just one below the other. So the air has to go through this so that it reaches the lung, and then that is how. So this is what is an airway when somebody is lying down. You are supposed to extend the neck. What happens? When you extend the neck, this airway is blocked by the tongue, as you can see. This tongue is blocking the airway. When you extend the tongue and lift the jaw, the airway gets cleared. Then the air can go directly. So whether it is blocked or not, if it is blocked, we are supposed to clear the airway. Now, what are the signs and symptoms of airway? How will you identify that this person's airway is blocked without doing anything? So you have to just keep your ear close to the victim, and if there is gurgling sound, if it is coming, or if the breathing is noisy, you know the airway is blocked. Stridor is basically difficulty. There will be a sound created from the throat. This is what is called a stridor. So gurgling sound, stridor, or cyanosis. Cyanosis means bluish discoloration of the tip of the fingers or tip of the tongue. If you observe the tongue of the victim, if it is blue, you know that the airway is blocked, the oxygen is not reaching, this patient is not breathing, this person is not breathing. So this is how you need to identify by going near the victim whether the airway is blocked or not, or there is something. So this is what I was talking about, maneuvers to open the airway. How you are supposed to open the airway is basically by head tilt and chin lift. So with one hand, you are supposed to tilt the head, and another hand, you are supposed to lift the chin. This is the maneuver where if you do head tilt and chin lift, the airway gets opened. We will show you on the mannequin as well. So head tilt and chin lift with a 2-finger lift and head tilt, something like this. Okay. Another maneuver that you can do is the jaw thrust maneuver, which is little difficult than this. In the jaw thrust maneuver, what we do is we push our thumbs on the jaw, and with the 4 fingers, we try to lift the jaw. So we try to do like this so that the airway opens. Okay. So head tilt, chin lift, and jaw. This is called a jaw thrust maneuver. With that also the airway opens. So last part was breathing. CAB, circulation, airway, and now is the end of the cab in the form of breathing. If you identified the airway was blocked, if you have removed something that was obstructing the airway, when you have done the head tilt and chin lift and a jaw thrust maneuver, the airway is now patent. So your next thing is to restore the breathing of the patient by doing. So what is breathing? Basically, when we breathe, so this is the basic apparatus where this is the upper airway, larynx, trachea, bronchial tree, and it goes to the lungs. And if you see the last part of the lung is called as alveoli. So there are air sacs in the lung, and there are millions of air sacs. If you unfold this alveoli of both the lungs, it is said it will be more than 2 to 3 times surface area of a tennis court. That much area is there in this small both of the lungs. And this is how, wherein the artery and the vein comes, the impure blood comes, we breathe in oxygen, the oxygen gets transmitted to the blood, it goes via this to the heart, and then the whole heart circulates to the whole body. This is how we breathe. Basically, this is how oxygenation and simultaneously carbon dioxide that is produced because of metabolism in the body gets excreted through the another route. We exhale carbon dioxide in that case. So this is breathing. So objective of this is to identify signs of breathing and to provide a rescue breath. See whether the patient is breathing or not. If not, you are supposed to give the rescue breath. So in C, circulation, we saw that we identify whether circulation is not there. Then we give chest compressions. In airway, we saw that airway is compromised. It is obstructed. We clean things. We open the airway, and then now breathing. Then objective is to give the rescue breath. So there are 3 modes of rescue breath. The most important and effective would be mouth to mouth. But if you are not comfortable doing that, no problem. You can do a mouth to nose and stoma. What happens? You can put a rolled paper or a rolled cardboard or something in the mouth, and with that from the top. So it will act like a funnel basically, and then you can give breath through that, or otherwise you can put your handkerchief on the victim's mouth and then you can put your mouth on that and then you can give breaths. But giving breath is equally important. But if you are hesitant and you are not able to give that, most important thing is the CPR, the chest compressions. At any point of time, you should not disturb this chest compression, because the method and the way you are going to do the chest compression is going to tell whether this victim is going to survive or not. So this is how the rescue breaths are given. So head till chin lift, and you are putting your mouth against the rescuer, and then you are supposed to take a deep breath and then put your mouth across, and with one go you have to blow in the patient's mouth so that your air reaches his airway, and then there is an expansion of the lungs. So this is how, this is direct mouth to mouth. This is a mouth to mouth by putting the handkerchief on the victim's mouth, and then you can still give the breath, rescue breaths. So this is how it is given. You can see in the picture, and you are supposed to give 2 rescue breaths for 30 compressions, each over 1 second. You are not supposed to waste more time. You can see here in the diagram how he is taking breath and then putting your mouth and giving the rescue breaths. So each rescue breath over 1 second, 2 breaths, and it is effective. How we will come to know is it effective or not? With the breath, the victim's chest should expand. The chest should come up. There should be a rise in the chest when you give a rescue breath to the victim. Okay. So this is about, this is the automated external defibrillator. This is the machine that we were talking about. These are available now on the airports and other important areas. This is a very, very useful machine, and a lay person also can use it. It's very easy to use. Everything is self-explanatory. In T2 International Mumbai Airport, you must have seen the red machines kept at several places. This is called as automated external defibrillator. I'll explain you about it. So what are the indications? Basically, if the victim is no breathing, no response, and no pulse. If there is no pulse, he is not breathing, and you find that there is no response, no breathing, and no pulse. So all these 3 things has to be there before you start this machine. Okay. So you have to just open the machine. It is absolutely self-explanatory. The machine will give prompt on. You have to on the machine, follow the commands given there. The machine will give you commands so that you come to know what is to be done next. So once you open the machine, and there are pads, there are paddles there, which are you are supposed to put the paddles, one on the right side of the chest and one on the left side of the chest, and you are just supposed to go away. We are just supposed to stay away from it. Once you put the machine on and put the paddles to the patient, the machine starts analyzing rhythm. What kind of heart rate, heart rhythm this patient is having, or is there a rhythm or not, that the machine analyzes. Okay. Then the machine will say shock indicated. Machine will shout. You don't have to do anything. And then your shock indicated, the machine will tell you are supposed to say I clear, you clear, everybody clear. Because if you are in touch of the victim when the machine is giving shock, the same shock can be delivered to you also. So you are supposed to clear everything, and then you have to press the button to deliver the shock. Deliver shock, and then the shock will be delivered. After the shock is delivered, after the machine has identified that this is the problem with the patient, he requires a shock to be given, then you are supposed to resume the CPR, cardiopulmonary resuscitation. We will show you here, hands-on. You are supposed to press on the lower half of the sternum with the full hand, and your whole body pressure should fall on the victim so that the chest wall goes in and then it recoils back. It goes in and then it recoils back. So 30 such compressions and 2 rescue breaths are to be given after the machine delivers the shock. So what are the cautions? Dry the drowning victim first. If the victim is already full with water, then you are supposed to prone him, ulta karke. You have to tap him so that the whole water comes out, and then you are supposed to start this. Because if there is full of water, the chest is full of water, then nothing will work. You will not be able to deliver the breath, as well as you will not be able to do the CPR properly. So in summary, always use AED, automated external defibrillator. I think every high-end society, or any society for that matter, is not such a high costly machine. Every society should have this in their basement, in their parking lot, or wherever you find that this might happen. So always use AED if it is available. Resume CPR immediately. Once the machine delivers the shock, we need to resume the CPR. This is what I would like to tell. So CPR saves lives. Are you ready? We'll see. We'll show you again. And this is Global Hospital Emergency number. We are just neighborhood to you. We are just a call away. And in the past also, there are incidences where the patients from your society reached in time and we could give them a very good outcome, because time is the essence of recovery in any disease. May it come stroke, may it come heart attack, or may it come any emergency for that matter. You reach in time, you will get well soon. So that is what I would like to tell, and our brother will demonstrate how the chest compressions are to be given on the mannequin. And then we can take question answers. इसको घुमाने के लिए yeah.
Dr. Harish, if you can stop sharing the presentation so that I'll spotlight this.
Yeah. Yeah, do we start? You just tell us, we'll start.
Yeah, please start now. Yes, Dr. Harish, you can start.
Yeah. So brother Abhi is there, and this is the mannequin that I was talking about, on which we are going to show you how the CPR is to be given. So he will show from the first step, identifying basically you are all right or not, and then we are doing a CAB. Circulation, airway, and breathing.
Okay, good morning. My name is Abhi Agustin. I'm one of the staff in Global Hospital. I'm demonstrating how to do the CPR. The one of the victim is unconscious. They are not responding to your call. Then first we have to check the response. Then how we'll check the response? Then tap the shoulder. Are you okay? Are you okay? Are you okay? 3 times. If no response, why it's tapping to shoulder? The shoulder, when the tapping the shoulder, it's paining, this hard pain. Then if the victim is deep sleep, then the victim will to be conscious. Then if the patient is in cardiac arrest or the heart is stopped, then the victim will not respond. Then that time we want to call for help. First step, we'll call for help. Then we can unable to do all things in one person. Okay, then we want to call for another person for help. Then next step is, then we want to check
more sound, please.
Yes.
More sound. Increase your volume sound.
Volume. Table को नजदीक ले सकते हैं क्या हम, so that you will be closer to the laptop.
सर मास्क हटा सकते हैं क्या? मास्क हटा जब तक हाँ that will be help, more help. Yeah.
थोड़ा सा आप जोर से बोलेंगे तो I think it should be fine.
Will do.
Now it's audible.
Yes.
Yeah.
Better.
Yeah.
Thank you.
First step is check the response. Okay. Then if no response, if the patient is responding, then we want to give airway protection. Okay. If the victim is not responding, we want to call for help for another person. Okay. Then next step is we want to check the pulse, carotid pulse. Sir already explained, check the pulse. It's the carotid, here is the place.
Yeah,
the
so
carotid.
as I explained you have to palpate the center part of your neck. There will be airway pipe, and then go to the lateral side, and then there will be a pulse here. So you have to just swipe your finger in the middle of the neck, go laterally and see the pulse.
Okay. We want to check the pulse. If the carotid pulse is there, then compulsory we will feel the pulse. Okay. Then if no pulse, then suddenly we want to start CPR. Cardio resuscitation pulmonary. Okay. Then how we'll give CPR. Then we want to check the in the medical side we will call sternum. But
Yeah. So as I told you, you have to just below this, there's the depression, and then there's the sternum here till it ends here. So this is called Zephyr, and this is called as manubrium of the sternum. You are supposed to put your hands at the lower half of the sternum. As he is putting now, he's putting at the lower half with your palms lock, your hands straight, and now he will start. 1,
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
As you can
13,
see, his
14,
hands are
15,
straight.
16, 17.
There is no
18,
bending of
19,
the
20,
arm.
21,
His
22,
whole
23,
weight is
24,
falling on the
25,
victim.
26,
As you
27,
can
28,
see,
29, 30.
is going down and up, down and up, down and
Down
up.
and up.
1.5 inch, you have to go down basically and then let it recoil. 1 to 1.5 inch. Yeah.
Then 30 compression we want to give. Then after 30 compression, we want to give 2 breaths. Okay. Then sir already explained how we'll give breath. Then mouth to mouth, or we want to with the help of kerchief or with the paper tunnel.
Yeah.
Okay. Then again we want to continue after 2 breaths. Again, we want to continue CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 29, 30. Then again, breath, 2 breath.
How to open the airway now? We'll show you how to open the airway. As I was telling you, the head tilt. So head tilt and chin lift. With the hand, the fingers, you are supposed to head tilt. So this is basically head tilt. You can see the jaw is moving, head tilt, and then you are supposed to do a chin lift. With the chin lift, the airway will open. So head tilt and chin lift, and then you go near the patient. See whether there is that sound that I told you of the stridor, gurgling sound. If something is there, if you see that there is something in the mouth, you can just swipe your finger and remove something like a palm, gutka, or whatever is there inside you. So now your airway is clear. Once your airway is clear, you have completed 30 compression. You are supposed to go to the mouth and then you do 2 rescue breaths. Each breath over 1 second.
Then
Once you complete the 2 rescue breaths, you are coming back again on the CPR mode,
Yes.
and again you are doing the chest compression.
continue the CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Yeah.
Then again 2 breath.
So
Then
this how long to continue? Okay, you are supposed to do 2 cycles. So 30 as to 2 becomes 1 cycle. Then again you are going to go for the second cycle. After 2 cycles, if you find that the victim is opening eyes, your work is done. Or intermittently, you are supposed to again keep on checking pulse. If the pulse is still not there, you are supposed to continue till the help arrives, or till the doctors arrive, or till the medical facility arrives in the near the scene, or till the time the pulse starts again. Okay, we are open to questions as we are doing things so that we can demonstrate and answer your questions as well.
Yeah, Dr. Harish, somebody has, Vijay has written a comment that if you can please show the rescue breath while you have explained it, but is it possible if you can just show by doing this 2 rescue breath which you are saying?
2 rescue breaths.
Yeah. Then head tilt, chin lift. Then take deep breath and mouth to mouth. Then at the mouth to mouth and blow the breath. It's clear.
Doctor, you said that you have to give only for 1 second. The breath you have to give only 1 second,
So
or it's long breath.
No, 1 breath or 1 second, and then you are supposed to repeat it
2 times.
2 breaths for 30 compressions. 30 compressions, and then 2 breaths, 1 breath, and then you have to again deep inhale and again exhale in the patient's mouth, and then this will be second breath, and then you are supposed to continue the CPR.
So the exhale in the mouth of the patient should be longer than 1 second. Na? When we normally exhale, it takes quite a long.
Yeah, I know. I am telling that it should not take more than 1 second.
Okay.
See, whatever deep breath you can do, you can deliver it at 1 go. Now you cannot deliver, so you have to again
Yeah.
Take deep breath yourself and then blow inside the patient's mouth.
Okay. Okay. Thank you.
Yeah, so Dr. Harish, there is a comment from Mr. Vijay again that when we exhale, it is CO2, not oxygen. So if carbon dioxide is going in the breath, is it okay? वो तो मुंह से तो CO2 निकलेगा.
See, our aim is to our aim is to inflate the lungs now. Our aim is not to give oxygen, because
Right.
you cannot give direct oxygen unless the oxygen is available around you or you have the device to give the oxygen. Okay.
Yes.
But the exhale breath does not contain 100% carbon dioxide. It definitely contains some part of oxygen also. It's not like you are just giving carbon dioxide to the patient and it will harm the patient. The aim is basically to keep the lungs open so that if you re-establish the circulation, the same should go to the lungs, and then the lungs will give oxygenation, and then it will go to the whole body. So the aim is not to give oxygen, but to complete the cycle basically, so that the patient starts breathing again.
Right.
You can call in the meantime the cardiopulmonary team.
Yeah.
In the meantime, when the whole team comes
Yes.
with the various code and all that.
Basically, a rescue would given initially, so that by the time team comes, you are not leaving the patient without any resuscitation, because the more the number of time that the patient is without pulse and circulation and the breathing, the more time the patient will come out of it or may not come out of it also, if there is a lot of time lapse in it.
Yeah. Yeah, sometimes you need 2-3 people because
Yes.
one person gets tired also.
Yeah. So that is why I was telling, if you don't have anybody around, then don't give rescue breaths, just concentrate on compression. Chest compression is the one that is going to save the patient. If you can give 2 rescue breaths in between, if you have 2 performers, one is giving breath and one is compressing, he completes 1 cycle and then you switch over, because it's a very tiring work. One person cannot continue compression for 5 minutes. He will himself get very tired.
Correct.
So that's why you need to at least have 2 persons. That's why you need to call for help, as well as tell the medical facility where this is happening and what you are going through. And then till the time the help arrives, you are supposed to continue this.
Read of the crowd, which is normally with, who are little curious what is happening. So try to clear the crowd around you so that you can work
absolutely.
better.
There should not be a chaos. There should be people helping you rather than disturbing your work.
Correct. Yeah. My name is Dr. Ravindra Parekh.
Yes, sir.
We have every 6 months there is a training program, for the entire staff.
Correct.
Anyway, it was a very nice demonstration.
Okay.
Thank you so much.
Thank you, sir. Thank you for your kind words.
And Dr. Harish, if a person is suppose drowned, तो पानी में से निकालते हैं तो सबसे पहले तो उसका पानी निकालना होता है ना पेट में, तो उल्टा करके पहले पानी निकालते. कैन यू जस्ट प्लीज एक्सप्लेन, यदि किसी को डूबते हुए बचाते हैं किसी को, तो उस टाइम क्या एक्टिविटी स्टेप्स रहती है?
So डूबते में बचाते हैं मतलब victim is drowning in the water basically. So what happens once somebody breathes inside the water, the whole water enters the airway as well as other system. So डूबते हुए बचाने में पहले बाहर निकाल के उसको उल्टा करना है. Okay, and you have to press the abdomen first, so that whatever water is gone in the abdomen comes out, as well as the chest part. Whole water should get drained, and then you have to make him straight and then start your CPR if he is not having circulation and breathing.
डॉक्टर उल्टा करके बैक से प्रेस करना है. जैसे स्विमिंग पूल में कोई डूब गया, नॉट दैट हार्ट स्टॉप हो गया बट पानी तो अंदर चला गया, तो उस केस के अंदर उल्टा, जैसे आपने कहा उल्टा कर देंगे, उल्टा करने के बाद बैक से ही स्टमक और चेस्ट को दबाना है.
यस. So आप अगर बैक को दबाएंगे तो in the process the stomach as well as the lungs both will get compressed.
Yeah, that is true.
और if उल्टा नहीं कर सकते तो एक साइड में कर लीजिए, because what happens, आपने पानी निकाला, ऐसा ना हो कि पेट का पानी निकल के छाती में जा रहा है and again it is causing problem. So recovery position ले सकते हैं या फिर prone करके उसको प्रेस करके पानी निकाल सकते हैं.
Can you tell me how the defibrillator, how much it costs?
I don't have an exact estimate of the cost. Our team here at Global can help you in knowing the cost, but should not be more than, I think, 1.5 to 2 lakh rupees.
2 lakhs of rupees.
Yeah.
It's expensive.
But it
You
is
can't keep it at.
it is worth a life saved, I'll tell you. It is worth
So-
a life saved.
Yeah.
Society can keep. I think
Yeah,
we should
yeah,
have at
yes.
Ashok Tower our facility at least.
That's
we should
right.
have one.
That is what I was
Mm.
mentioning, that society should keep one in the basement where the parking is there, and one wherever you feel that there is crowd.
Clubhouse
Yes.
mein ho.
Absolute. Clubhouse and parking.
Thank you.
Yes, yes.
So any more questions by anybody?
Yeah, I have put one question. I'm not sure I can find the pulse that easily. How exactly is, how much do I have to press on? Is it on the left side or the right
No,
side?
if you press deep, then it will not be. So you have to just go either on the right or on the left, anywhere is okay. Once you have seen the depression, you have to just gently palpate. If you press like this, you will not be able to palpate. And it has to be palpated at the tip of the finger, not at the side. So once you go side and just put your finger,
Yeah, yeah.
3 fingers, so that if one cannot feel, the second or third can feel. And it is just straight from here. It is just beside your windpipe. It is coming straight from the heart and going up. So it is just a straight line. You have to just go there in the depression and palpate.
Okay.
Yes, we can feel.
Yes, yes, you will be able to. You will be able to.
Yeah. We are able to feel. Yeah. Good. It was very, very, very informative. And I am, of course, not a biology student ever. So it was for me first time, and I really liked it. Very good.
Thank you so
Thank
much.
you.
Our aim and our motto for this is to teach you, as well as you should spread this word around, because our team alone cannot teach so many people around in Mumbai who definitely are in need of this whenever it happens on the railway station or mall or in the cinema hall. But this should be spread as a word of mouth, so that you teach 5 people, these 5 will again teach somebody else, and this is how we are supposed to spread this knowledge.
So, Doctor, just tell me, say, if we just phone up this emergency number in global,
Yeah.
and Ashok Tower is just next door. So, how much time normally the ambulance would take from global to reach the Ashok Tower?
I would say not more than 10 minutes.
That is good. That is good.
We are absolutely emergency ready 24/7. Our team, the ER team, the ambulance, everything is absolutely ready. You just give a call. We will be there in 10 minutes.
So ambulances are available all the 24 hours.
Most of the times.
Okay. Very good.
So Dr. Harish, I think it is very, very great session. And I will request all the participants who have attended this session that please teach it to all your family members also.
Yes.
यदि आपको खुदा न खास्ता यदि आपको जरूरत पड़ती है इसकी, तो आपके जानने से कोई फायदा नहीं है इसको.
Yes.
आपके फैमिली मेंबर्स को जानना बहुत जरूरी है आपके लिए, आपके खुद की हेल्थ के लिए. तो ये इसीलिए every family member should know about this basic technique. And if all of us in Ashok Tower can know about this, then naturally, it can be helpful for the whole society's health. So,
Yes.
Dr. Harish, on behalf of all the participants in Ashok Tower, I want to really thank you and your colleague who has demonstrated very, very well. And Amish also. Amish, if you are there, thanks a lot for coordinating. Amish is part of Global Hospitals Marketing, and he was helpful in coordinating with Dr. Harish this whole session. Thanks a lot. And Dr. Harish, I'll be in touch with Amish for conducting one more session on all the various first aid activities which people should know.
Yes.
So maybe sometime in March, we will
Yes.
have one more session on various first aid activities.
Yes.
So with that, I want to thank you, the whole Global Hospital team. And I also want to inform all the participants that on our next session will be on March 20th, which will be it will be taken up by Shruti Agarwal of C Tower. And she is going to talk about gene mapping and optimal preventive nutrition. Basically, हम सबका DNA अलग-अलग है और हमारे DNA के हिसाब से हमारा nutrition कैसा होना चाहिए, उसके बारे में Shruti will talk about it. She is an expert in that area. So everybody's nutrition, how it can be customized. हर एक के DNA के हिसाब से nutrition कितना customize कर सकते हैं, उसके बारे में वो session लेगी, which will be on 20th of February. Next fortnight Sunday. So with that, I thank you all and thank you Global Hospitals team.
Thank you all.
Thank you, Doctor. Thank you. Thank you, Doctor. Amish is always approachable. I think
Sure,
we keep on getting WhatsApp messages from him. Thank you, Dr. Harish.
Thank you, sir.
Bye. Bye. Bye.
Bye bye. Namaskar.
एक चीज हमेशा पूछी जाती है, अगर not able to answer.